Rocky Mountain Spotted Fever, commonly abbreviated as RMSF, is a potentially life-threatening infectious disease that demands both awareness and swift medical intervention. Recognized as one of the most severe tick-borne illnesses in the United States, RMSF is caused by the bacterium Rickettsia. Understanding the nature of this disease, its modes of transmission, clinical presentation, and treatment options is crucial for effective prevention and management. RMSF primarily occurs in North and South America, with the majority of cases reported in the United States, particularly in the southeastern and south-central regions. Despite its name, the disease is not confined to the Rocky Mountains, but can occur in a wide range of geographical areas where the tick vectors are present. The primary vectors responsible for transmitting Rickettsia rickettsii to humans are the American dog tick, the Rocky Mountain wood tick, and the brown dog tick. These ticks become carriers of the bacterium after feeding on infected small mammals, such as rodents, and can then transmit the infection to humans through their bite. The transmission of RMSF typically begins when an infected tick attaches to human skin and feeds on blood. The risk of transmission increases the longer the tick remains attached, with most cases resulting from ticks that have been attached for several hours. Engaging in outdoor activities such as hiking, camping, or walking through grassy or wooded areas during the warmer months of spring and summer increases the risk of tick exposure. Once rickettsii enters the bloodstream, it targets the cells lining the blood vessels, causing inflammation and damage to the vascular system. This process, known as vasculitis, leads to the hallmark symptoms of RMSF and can result in severe complications if left untreated. The incubation period, or the time between tick bite and onset of symptoms, typically ranges from 5 to 10 days, but can be as short as 2 days or as long as 14 days. The early symptoms of RMSF are often nonspecific and can easily be mistaken for other common illnesses. Fever and headache are usually among the first signs, often accompanied by muscle aches, fatigue, nausea, and vomiting. A distinctive rash develops in most cases, usually appearing 2 to 5 days after the onset of fever. This rash typically begins on the wrists and ankles before spreading to the trunk, arms, and legs. Initially, the rash consists of small, flat, pink, non-itchy spots, which may later become raised or develop into red or purple spots due to bleeding under the skin. In some cases, especially in the early stages, the rash may be absent or difficult to detect, making diagnosis more challenging. Other notable symptoms can include abdominal pain, joint pain, and in severe cases, confusion or other neurological changes. As the infection progresses, untreated RMSF can damage multiple organ systems, including the heart, lungs, kidneys, and brain. This can result in complications such as pneumonia, kidney failure, clotting disorders, and even coma. The severity of the disease underscores the importance of prompt recognition and treatment. Diagnosing RMSF can be challenging, particularly in the early stages when symptoms are nonspecific and the characteristic rash may not yet be present. Laboratory tests, such as serologic assays to detect antibodies against Rickettsia rickettsii or PCR testing to identify bacterial DNA, can help confirm the diagnosis. However, these tests may not yield positive results until later in the course of the illness. Therefore, clinicians are encouraged to make a presumptive diagnosis based on clinical presentation and epidemiological risk factors, and to begin treatment without waiting for laboratory confirmation. The cornerstone of effective RMSF management is the prompt administration of appropriate antibiotics. Doxycycline is the treatment of choice for both adults and children, regardless of age. Early initiation of doxycycline, ideally within the first 5 days of illness, dramatically reduces the risk of severe complications and death. Delays in treatment are associated with a significantly higher risk of fatal outcomes. The typical course of doxycycline lasts for at least 7 days and should continue for at least 3 days after the fever subsides, and until there is clear evidence of clinical improvement. In cases where doxycycline cannot be used, such as in patients with severe allergies, alternative antibiotics may be considered under specialist guidance, but these alternatives are generally less effective. Supportive care, including intravenous fluids, management of electrolyte imbalances, and monitoring of organ function, may be necessary for patients with severe or complicated disease. Preventing RMSF relies on reducing exposure to ticks and promptly removing attached ticks before they have an opportunity to transmit the bacteria. Practical measures include wearing protective clothing, such as long sleeves and pants, when venturing into tick-infested areas, using insect repellents containing DEET or permethrin, and performing thorough tick checks after outdoor activities. Pets, particularly dogs, should be treated with veterinarian-approved tick prevention products to reduce the risk of bringing ticks into the home environment. If a tick is found attached to the skin, it should be removed as soon as possible using fine-tipped tweezers, grasping the tick close to the skin's surface, and pulling upward with steady, even pressure. The area should then be cleaned with soap and water or an antiseptic. It is important not to crush the tick or use unconventional removal methods, such as burning or applying petroleum jelly, as these may increase the risk of infection. Certain populations are at higher risk for severe RMSF, including young children, elderly individuals, and those with compromised immune systems. Additionally, individuals who delay seeking medical attention or who do not receive appropriate antibiotic therapy in a timely manner are at increased risk of poor outcomes. Public health efforts to control RMSF focus on raising awareness about tick-borne diseases, educating communities on preventive strategies, and encouraging healthcare providers to maintain a high index of suspicion for RMSF in patients presenting with compatible symptoms during tick season. Surveillance and reporting of cases also play a crucial role in tracking disease trends and identifying areas of high risk. In summary, Rocky Mountain spotted fever is a serious, yet preventable and treatable, tick-borne illness. Recognizing the signs and symptoms, understanding the risk factors, and seeking prompt medical care are essential for reducing the burden of this disease. With continued public education, early diagnosis, and effective treatment, the impact of RMSF can be significantly minimized. For anyone spending time outdoors in regions where ticks are prevalent, vigilance and proactive prevention remain the best defenses against this potentially deadly infection.